up, DJ Nile? Hey, Brendan. So today's topic, we're going to be talking about LGBTQ youth. It's a topic that we don't often cover or we don't cover enough, so I wanted to bring this to you all today. I want to share some, tips, some pointers for parents, for educators, because it's not necessarily an easy thing working with or, being like having LGBTQ youth and work with them. So I want to be able to share things that might help you, support our youth. And if you have any questions, you can feel free to drop them in the comments. So again, today, for those of you, I see a lot of people joining right now. We are going to be talking about issues that impact LGBTQ plus youth. And I'm going to share some advice for everybody. So again, if you have any questions or comments, feel free to reach out to us in that comment field, or you can use the questions bubble that's located on the right, in the right corner. I also want to remind you all that Whitman-Walker Health is still open for HIV and STI testing. That is by appointment only, and you can call our number at 202-797-4439. We are also still doing COVID-19 testing, so you can call us at 202-745-7000. We are also accepting email appointments, and you can do that by emailing us at appointments@whitmanwalker.org. So glad to see that Brendan and DJ Now could join us today. Look, I see some other familiar names and faces in the building. But let's get started. If you do not know me, I am David Wilson. I've been with Whitman-Walker for over a year now. I come on here to talk about, sexual health practices, social determinants of health, anything that can help our community and make sure that we stay healthy and whole. I also cover topics about COVID-19 and how we can protect ourselves against this virus that has been impacting all of our lives. But today, again, the topic is focused on LGBTQ youth. If you do not know me, my pronouns are he, him, his, and yeah, let's get started. Vaccination appointments, good question. So if you need a vaccination appointment, you can also email us at appointments@whitmanwalker.org. That was a great question. All right, so, compare with, other students, LGBTQ youth experience violence that is particularly increased compared to our other students. One of the violence is literally some of the most impactful events that occur to our LGBTQ youth. That can include behavior such as bullying, teasing, harassment, physical assault, etc. I actually reviewed a survey before I got on this live today, and I want to share some data from this particular survey. So there was a survey that occurred back in 2015. The survey's name is the Youth Risk Behavior Survey, also known as YRBS. This survey actually went out and surveyed LGBTQ youth and asked them several questions about their experiences in school and life, in school and life outside of school. 10% of those participants actually said that they were threatened or injured with a weapon on school property. So I know that's probably like a surprising number to people, but it's the reality from this survey. 30% actually said that they were bullied on school property. 28% said they were bullied electronically, or you may have heard people refer to that as cyberbullying. 23% of LGBTQ youth said they had dated or went out with someone during the 12 months before that survey had taken place and experienced sexual dating violence in the prior year. 18% of LGBTQ students had experienced physical dating violence, and also 18% of students have been forced to have sexual intercourse at some point of their lives. So if you can imagine, we have to be there to support our LGBTQ youth. And towards the end of this, I'm going to share resources and things that we have available, not just at Whitman-Walker Health, but outside of Whitman-Walker Health for our LGBTQ youth. Another part of a major issue that affect LGBTQ youth is, they may have experienced impacts on their education or their mental health. So exposure to violence can actually have negative effects on the education and health of any young person, and may account for some health-related disparities between LGBTQ youth versus heterosexual youth. In 2015, that same survey I mentioned earlier, 40% LGBTQ students were 140% more likely to not go to school at least one day during a 30-day period because of safety concerns. And that is like compared to their heterosexual counterparts. While now there isn't a direct measure to school performance, based on absenteeism, but it can be linked to like low graduation rates, which ultimately have like lifelong consequences. A complex that we know that can really impact the health of our LGBTQ youth. So if folks who don't graduate high school have a higher risk for have a higher risk or lower threshold of earning income, and so that can create health outcomes and disproportionately to our LGBTQ youth. Also, LGBTQ youth are at greater risk for like depression, suicide, substance use, sexual behaviors that increase their risk for like HIV and other sexually transmitted diseases. Also, this survey identified that 1/3 of LGBTQ youth had attempted suicide at least once in the prior year. Now, I don't know about you all, but I found that to be a devastating statistic. And that is like compared to 6% of, their heterosexual youth. In 2014, young gay and bisexual men actually accounted for 8 out of 10 HIV diagnoses among youth. So that is beyond disproportionate. Again, I'm going to share some information at the end that we could help support our LGBTQ youth. So stay tuned for that, because I think everybody should be around to hear some of this stuff. All right. Now, when we talk about LGBTQ youth, that also includes our transgender youth. And sometimes like we miss those particular discussions that target our transgender youth. And, transgender and gender expansive youth actually face many serious challenges in the school system. In addition to overt like forms of discrimination, such as, verbal discrimination and physical harassment, they also report being barred from like using locker rooms and bathroom facilities that match their gender identity, and not being addressed with their appropriate pronouns. So if you notice, we at Whitman-Walker, when we introduce ourselves with our pronouns. I'm David, he, him, his are my pronouns. And I definitely encourage you all to like try to incorporate that practice into your daily lives, whether, you feel comfortable doing that at the workplace or even doing that with your children. It might actually encourage a conversation that you have not been able to have with them. Supporting our youth with their chosen names and their gender identity is extremely important. So these negative school experiences can have some damaging implications for our transgender and gender expansive youth. It can create hostile, learning environments where they feel unsafe and protected. And obviously we don't want that for anybody, but particularly for youth that has been disproportionately discriminated against. So if you work in a school, whether you're a teacher, an administrator, or a principal, I do have some like practices that you can implement to promote health and safety among LGBTQ youth. Firstly, the first practice I would say is, encourage respect for all students. And that helps encourage helps encourage stopping of bullying and harassment and other violence against not just LGBTQ students, but all students. Particularly for LGBTQ youth, it's important that you identify safe spaces. That can be, counselors or an office that's designated to, supporting LGBTQ youth, or designated classrooms where LGBT youth can receive support, whether that be from administrators, teachers, or other school staff. Having those safe spaces are extremely important and creates an inclusive environment for those students. Also, encourage student-led and student-organized school clubs that promote a safe and welcoming and accepting school environment. So, for example, you could maybe create a gay-straight alliance or a gender and sexual alliance, or you can create other school clubs that are open to youth of all sexual orientations and genders. Another tip would be ensure that, health curriculum and education materials include education about, HIV safe practices, other STD safe practices, and pregnancy prevention information that is relevant to LGBTQ youth. So you can ensure that, your curriculum encourages, inclusive language and terminology that can be, that can relate to our LGBTQ youth. Also, provide trainings to school staff on how to create safe and supportive school environments for all students, regardless of their sexual orientation or their gender identity, and encourage staff to attend these meetings. And I know I said encourage, but I personally think it should be a mandatory. I don't know how you will be able to incorporate that, but if you can, make it mandatory for these folks to attend these trainings so that they're actually able to support these students appropriately. Another thing that you can do, you can facilitate access to community-based providers who experience providing health services. That could be Whitman-Walker Health. You can include HIV and STI testing and counseling, social and psychological services to LGBTQ youth. If I remember back in my high school days, I remember our curriculum, designated specifically around heteronormative type of sexual health practices. And I kind of was, uncertain of my sexuality at the time. But had that been a space where, they could have talked about safe practices when it came to, having, same-sex relationships or same-sex intercourse, I think that would have been more beneficial to my experiences. So create spaces, add that to your curriculum, facilitate conversations with counselors that are familiar with being able to communicate those type of practices to LGBTQ youth. Also, I have some tips for parents. So if you are a parent of, a LGBTQ plus individual, I think it's important that, you be supportive, but I also want to give you some tips that can support the health and well-being of our LGBTQ youth. First off, I think it's extremely important for not just, communicating with, your child, but to anyone. The first thing you want to listen, right? Listen first and then talk next. Parents who talk with their children and listen to their teen in a way that invites an open discussion about sexual orientation can help, the teen feel loved and supported. So I think it's important that, you still have honest conversations with your teens about sex and how to avoid risky behaviors and unsafe situations. But you want to make sure that you listen to their experiences, listen to them, and make sure that you create that open space that they feel comfortable talking to you about their sexual practices. I think that's important. And if you're uncomfortable facilitating that type of discussion, there are Whitman-Walker resources that can help you with that. So you can visit our whitmanwalker.org site and visit our LGBTQ resources, and we can have you or help you have those type of discussions. Also, just provide support. Parents who take time to come to terms with how they feel about their teen's sexual orientation will be more able to respond calmly and respectfully and use respectful language when communicating to their teen. I think parents, should develop common goals with their teen that can include being healthy, having healthy sexual practice, doing well in school, building, successful relationships, whatever it is that, your teen kind of desired, create that safe space with them and be able to create a shared goal so that you all can work towards that together. More importantly, stay involved with them. Parents who make an effort to know like who their teen's friends are and know what their teen, is doing on a day-to-day basis can help their teen like stay safe and feel cared about. I think it's important that we not judge our teens, but more so support them and guide them and what they're doing and what they choose to participate in, whether that be, outside of school or their friendships, but just stay connected to them. Also, a good thing is, be proactive. Parents can access many organizations and online information resources to learn more about how they can support their LGBTQ plus teen. That also includes, educating other family members and educating, your friends or teen friends. You as a parent can, help facilitate those conversations and help align people with the resources needed to support your teen. Also want to share some actual resources that you can utilize to help you facilitate those conversations. So positive environments are extremely important to help all youth thrive. However, we have the health needs of LGBTQ youth can differ from their heterosexual peers. And so I want to provide a few resources that, your youth or their friends, educators, parents, and family members can use to create a positive environment for our LGBTQ youth. These particular resources are specifically for, LGBTQ youth and friends or supporters. So you can go to the Genders and Sexualities Alliance Network. Their website is gsanetwork.org, and they have a ton of resources on their website. They do blog posts. They share other resources that I might not share here, so you can go there and check it out. You can go to the Gay, Lesbian, and Straight Education Network, which is also known as GLSEN. And they have a student action site on their website. So if you go to glsen.org, there's a student action page where they share a lot of resources for LGBTQ youth and their friends. One project that I actually like a lot is the It Gets Better project. You can visit itgetsbetter.org, and they have tons of resources for LGBTQ youth, specifically around mental health, sexual health. It actually is a extremely resourceful page, so I definitely encourage you, even if you're a parent or you're youth yourself, visit itgetsbetter.org. Tons of resources. Now, if you're an educator or an administrator, Advocates for Youth has LGBTQ resources for professionals on their website, and their website is advocatesforyouth.org. Found that to be extremely resourceful. They give advice on how schools and administrators can create safe spaces. I even found a guidebook on their website that details a plan on how you can implement some of this stuff into your organization. So definitely encourage you all to check out Advocates for Youth. Again, their website is advocatesforyouth.org. Another personal favorite is the Trevor Project. The Trevor Project is extremely popular because they do a really good job with education and resources, not only for adults, but for youth as well. So check out the trevorproject.org. If you are an educator, the website that's specifically designated for you is it's trevorproject.org, thetrevorproject.org/education. Now for parents, someone had FaceTime me in the middle of it. For parents, LGBTQ youth. Bye. Sorry about that. A question. I have a question. Feel free to type it in. There, you can use the question button. Great question. So you can make an appointment by email, but you can also call our number as well. So it is a new way to make an appointment, I would say, but you can still call us at 202-745-7000, and you can make an appointment for COVID-19 testing or HIV STI testing. Hope that answers your question. If not, feel free to let me know. So back to the resources for our parents, guardians, and family members. So for parents and guardians, the Family Acceptance Project is an amazing project that provides support, resources, guidance for our parents. We know it's not necessarily easy to like, you know, have a team come out to you or even be able to support that team. So we are providing these resources to help you with that, help you and provide guidance on that. So if you visit the familyproject.sfsu.edu, and I'll repeat that, it's the familyproject.sfsu.edu. And you can visit that for all the resources. So I have a question. So I've been using the patient for it. I didn't get a response. That's why I asked. Okay, yeah. So, if you have a provider, you could also call Whitman-Walker and ask for your provider's email. I have a provider at Whitman-Walker, and I've been able to email them directly if you're trying to get an appointment with your provider. Or you can also call the 745-7000 number to make an appointment with your provider. If you're looking for HIV and STI testing specifically, that is, you can email appointments or you can call Whitman-Walker directly. And if you're looking for COVID-19 testing, same well. Also, if you're looking for a vaccination appointment, you can also email us. Got it, vaccination appointment. So yes, if you try appointments at whitmanwalker.org and or you can call the 202-745-7000 number. And sorry that you haven't been able to get it through the patient portal, but if you call that number or email, you should be able to get some help there. And thanks for that question. Also for parents and families and friends and allies, PFLAG, which is extremely popular. You can visit pflag.org. They have resources for our LGBTQ youth and parents and guardians and family members. That is a very popular and has been around for a while. And so, you know, there are tons of resources. There are tons of information for you all. I definitely encourage you to visit that one. One other resources that I would like you to visit is smile.org, and it's not spelled SMILE, it's smile, SMYAL.org. So Smile is a nonprofit in DC that has many services and programs for our LGBTQ youth. You can also visit us at Whitman-Walker's Health Youth Services. So if you want, you can visit whitmanwalker.org/youth services for information on supporting LGBTQ youth. I hope that, you know, you can find this information that I share useful, and I want you to be able to make more informed decisions about supporting your LGBTQ youth. I actually remember coming out to my mom, and I wasn't necessarily a youth, but I was like 19 years old. And I remember her not having the words or knowing the words to say to be supportive. But the one question that you can always ask if you're unsure to say, if your child comes out to you, is, you know, how can I help you? Like, what do you need from me? I think that, or how can I support you? Those three questions literally opens up it creates an open space. It creates an open dialogue, and it might, you know, they might say nothing, or they might have some things that they, some insight that they need support with. So just be open. You're not going to know everything. No one does, but just ask what they feel they need to be supportive. And I think that is a great start. Just going to check to see if there are any more questions. And if you do have a question, feel free to drop it in the comments. Oh, I see. What about vaccination appointment? All right, we got that one. Thank you all. All right, so I don't see any additional questions. So I do want to remind you again that Whitman-Walker is still open for pre-HIV and STI testing by appointment at our Liz location, as well as our and the Liz location is in Northwest DC, if you didn't know. And then our Max Robinson Center location, which is located in Southeast DC. You can make an appointment by calling 202-797-4439. I do, before I close today, have to remind everybody that we are still in a COVID-19 pandemic. And if you didn't know, we have been seeing an increase in, the cases with the Delta variant. I know I read an article about maybe 3 days ago that actually said within a week that the Delta variant doubled in Los Angeles County. And so that was like a aha moment, right? So I think it's very, 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 very important for you to get vaccinated. There are still dozens of walk-up sites throughout DC where you don't need an appointment. You can just go and get your vaccine. And if you want to get tested for COVID-19 at Whitman-Walker, you can call 202-207-2480, or you can email appointments@whitmanwalker.org to schedule an appointment. Also, we are still going out to some of our outreach events, and we are registering people for vaccines at our outreach events. So if you happen to see us at one of those, feel free to come to the table and we can register you for a vaccine, for an appointment for a vaccine. And if you've already got vaccinated, congratulations. The CDC has given you okay to relax some of your mask wearing habits. However, as I just mentioned, this Delta variant, has been identified. It is growing. Cases are growing, unfortunately. Now we do have knowledge that our current vaccines still have some protection for that particular variant, so no need to go crazy or fear too much or anything. But you still don't know who doesn't or do have the vaccine. So if you want to wear your mask, continue to wear your mask, because the vaccines, are not 100% effective. So you can keep those particular protocols in place if you are vaccinated, and that makes you feel more comfortable. Now, for folks who are not vaccinated, we definitely encourage you to continue to follow the CDC guidelines. That includes mask wearing. If you get COVID-19, quarantine, continue to social distance, and everything else that we've been communicating, washing your hands and all that. It's still important that you get that vaccine. But, make sure that you continue to take those COVID precautionary measures when, whether it's especially when people are around you, right? So be mindful of wearing your mask if you're not vaccinated and keeping your distance, especially if you do not know whether or not a person near you has been vaccinated. I say this all the time, but it is still up to us to stop the spread of COVID-19. So we have to continue with this effort. And also, I'm going to say it again, please go get vaccinated. And if you cannot find an appointment, or if you're having trouble, we can help you at Whitman-Walker. And you can email us at appointments@whitmanwalker.org, or you can call us at a couple of numbers, apparently, 202-207-2480, or you can call us at 202-745-7000. Now, remember to continue to follow us on Twitter, Facebook, Instagram, and you can follow us at Whitman-Walker here, and then also at Real Talk DC _, but also follow us at The Corner, which is our location on 15th Street. We do cool art exhibits and other creative things there, so please check us out. And I don't see any other questions, so that is my topic for today. Thank you all for tuning in, and I'll see you next time.